3 weeks post-injury, the physician's had her non-weight bearing. So today we're going to start some pain-free exercises in the water. She's 25% weight bearing, and so all we're going to do is try to do the exercises that are too painful to do on the table or at her home right now. So we're going to go ahead and start by doing just some abduction exercises with her hip. Go ahead. And she just brings it back down to her foot. And I turn the jets on just to get a little bit of water going, not so much to create resistance, but just so that she can feel a little bit of that circulation of the water and the fact that she has been so painful due to the stress fracture that we just feel like circulation of the water would kind of help her a little bit. And then she goes from there into adduction, where I tell you what, let's turn and face John and do let's go backwards. So her leg extension, which would be the same thing as her prone leg extension, this was the only exercises that she could do on the table, pain-free. At 3 weeks post-op, she does have some capsular, or post-injury, she does have some capsular tightness. And so another thing that the water and the warmth does for her, exercising in the pool, is to help loosen that capsule up a little bit. And now let's turn around and face the computer. And let's go frontwards just like you're marching. And we're just going to do these exercises here just as a warm-up. And we usually do high reps on this. We would do about 3 sets of 20, set of 50. As we progress also, we like to use this little aqua jogger on her foot to add a little bit of resistance. If you put this on, it's going to provide a little bit of resistance as you go against the water. So throughout her rehab, we did use this a good bit. Okay, for this exercise, but this is the exercise that I call Trendelenburg exercise. Now the important thing is that you put the involved extremity up on the step. And so you're going to be working the contralateral leg. We lower the hip down, and then we teach her to hike it up. We don't get any bend at the knee, therefore she's having to use all of her gluteus minimus, gluteus medius to abduct that hip. This is a reverse muscle action, but it is very good exercise for those hip stabilizers. This exercise was very painful to her when she was just out. She couldn't do this unless she was in the water right now. And we may even lower her down a little bit so that she maintains pretty much at 25% weight bearing. You feeling that, Renee? When your patients are really feeling it and they're feeling fatigued, they should feel fatigued right on the side of the hip and maybe just a little bit posterior to the greater trochanter. And again, with her, we want to do high repetitions, mainly because she is so fresh out of the injury, but also because she's a long distance runner. She's not a power lifter. So therefore we want to keep her in that same mindset. Get your hip up level again, and you're going to swing your bad leg. Okay, there you go. I mean your good leg. I meant to say contralateral leg. Okay, all right, you ready? Okay, this exercise is very challenging, but it worked her really hard, and she's a competitor. So we had to find some exercises that were really going to challenge her a little bit. Renee, let's turn the yellow, there you go, turn it up like that. And then we're going to swing her non-affected leg, her contralateral leg, and again, we're going to be working on stabilization of her right hip. Okay, just go back and forth, try to stabilize your hip. And as she feels comfortable with that, I'm going to ask her to move side to side Still doing the same thing. This is very challenging. And you can kind of see what happens here. If you really want to challenge her, turn the jets on. And it's going to throw them off like that. There's not too many athletes can stabilize for that long with the jets blowing against her. So we'll cut it down with just enough of the jet to resist her. Where are you feeling that? And again, they're going to feel this on right on the lateral side of the hip and just posterior to the greater troch. With this exercise, we're working her hip flexors, her hamstrings, and a little bit of her quads. Again, we're trying to train her sport specifically to the type of activity that she has to do on a competitive basis. That's good. She's got really good hamstring flexibility, but she has lost a little bit of her hip range of motion. And of course, we can advance this, blowing the jets against her. And it would put a little resistance against her as she goes up to hip flexion. Let me see you do that without holding on. There you go. Good. Now try to keep your arms at your side. Not at your side, but kind of like in the running motion. There you go. Just not way out here where you have to balance. That's it. You in pain with that?
It just feels like muscle work.
Yeah? Good. And where are you feeling that? Where do you feel that the most?
In my calf.
In your calf? Pulling it through? Okay, so your quads and your posterior muscles, hamstrings, and your calf. Even 3 weeks post-injury, the very first day that she got in, she was wanting to be very aggressive, and the physician, he gave us the okay, but he wasn't exactly real keen on the idea. But we started jogging in the pool the very first day of treatment, and this was pain-free. Now, we also went from jogging to doing sprinting in the pool, where she drifts back and sprints into the jets. That's another great exercise to do. The specific exercises that I just showed you earlier were specific to her injury. So in order that I'm not redundant on exercises that are also on the resource library of the website, I just want to talk about a little bit about the fact that now it's just totally about your imagination. We've used the specific exercises for the hip, building up the gluteus medius, gluteus minimus, the adductors, the hamstrings, the quads. You've seen those. Now it's all about my imagination. We can run her. We can do some bounding in here, side-to-side shuffles. And as we progress over the next 2 to 3 weeks, then we would lower the water, have more weight bearing on the extremity. We're real fortunate to say that now she is 10 weeks out, and now she's ready to go on the land. She is jogging with no pain, and we hope to progress her over the next 2 months back to competition and running competitively.